We're going to continue our evaluation of the elbow and look at the medial side. 3 areas of interest on the medial side. Starting with the medial epicondyle, we're going to look for the common flexor pronator attachment. Going deep, we'll look for the anterior bundle of the ulnar collateral ligament. And then we're going to finish up with a short axis and long axis view of the ulnar nerve as it follows through the falx cubital tunnel to the true cubital tunnel and the 2 heads of the flexi-carpi ulnaris. So to start our evaluation one more time, I'm going to put my finger on top of the medial epicondyle of the humerus and draw a line approximately to the level of the little finger. Placing the transducer in long axis with the orientation marker pointing towards the patient's chest, I will be able to pick up the medial condyle of the humerus and the area of the common flexor insertion point, which is shorter and slightly thicker than the common extensor. Rotating my transducer clockwise on top of the medial epicondyle, we're going to see the epicondyle, and as I slide my transducer towards the fingers, you'll see the bundle and the complex of the flexor tendon bundle. Rotating my transducer back into a long axis of the flexor bundle, I'm going to move the transducer right over the top of the epicondyle, doing a slight rotation of the transducer so the orientation marker goes from the center of the belly towards the chest. And we're going to see the anterior bundle of the UCL as it goes down and attaches to the sublime tubercle on the ulna. Between the ulna and the humerus, you'll see the joint space. Now, what I'm going to ask the patient to do is take her right arm and put it on top of her humerus and kind of pin the arm down to the table. This allows a single person to do the valgus stressing of the anterior bundle of the UCL and check for any kind of joint opening at this point. The last structure that will be evaluated on the medial side of the elbow is the ulnar nerve as it traverses through the falx cubital tunnel to the true cubital tunnel. So in the short axis is where we start. The arm is in full extension. We have the medial condyle off to the right-hand side of the screen. We have the ulnar nerve sitting just adjacent to it. And as I move the transducer slightly posterior, we'll see the olecranon process. Now, with the arm in full extension and the transducer is locked over the top with gentle pressure, not heavy pressure, but gentle pressure onto the medial condyle, I'm going to do a slow flexion of the arm and keeping my eye on what happens to the ulnar nerve in full flexion, making sure not to use too much pressure to trap the nerve. Flex the arm into full flexion. We can see the ulnar nerve does not reach over to the top of the medial condyle. Over at the left-hand side is the short axis of the medial head of the triceps muscle. Going back to full extension, the nerve maintains its position in the falx cubital tunnel. Now we'll continue to do a long axis evaluation of the ulnar nerve into the falx cubital tunnel. Placing the transducer over the medial condyle, I'm going to slide posteriorly towards the olecranon process. The condyle will fall away, and we'll see a long axis view of the ulnar nerve in the falx cubital tunnel. Following the nerve towards the wrist, we'll see the nerve enter the true cubital tunnel as it goes between the 2 heads of the flexi-carpi ulnaris. For evaluation of the ulnar nerve in the falx cubital tunnel, I've chosen to use a microlinear, and the purpose for this is twofold. Number one is, as I place the transducer between the olecranon process and the medial condyle, it's easier for me to manipulate the arm and maintain contact. The second reason I use the microlinear is that during flexion and extension, I can keep the transducer in position without interference from bone movement.